COVID-19 has devastated the world, but there is another deadly global health threat that's right on our doorstep, and that's due to antibiotic resistance. This is unlike COVID. It is actually predictable and preventable, but it will unfortunately cause an exponential rise in deaths over the next 30 years, reaching 10 million. But what I find even more scary is what we're going to lose, and that's because every single one of us will be affected by this. And that's because antibiotics are the cornerstone of modern medicine. They're there to ensure your safe delivery into the world, and they're there if you need surgery or chemo. And without them, basically, superbugs have the power to plunge us back into the dark ages. But we have developed a new antimicrobial strategy, and this is our attractive killer platform. It builds on the success of immunochemotherapies that have been groundbreaking in cancer treatments. So this will be a first-in-class immunotherapeutic that binds directly to the superbug and links on and delivers a payload. And that payload is an immune activator, a beacon that basically attracts in our innate immune response. These cells are our natural-born killers and are essential for clearing an infection. So this beacon recruits the cells and enhances their killing. But what extends the life of our platform is that we can exchange that targeting element and basically target different groups of pathogens, or even change to targeting fungi as well. But first through our pipeline is one that targets Staphylococcus aureus. Basically, it's been declared a priority pathogen by WHO and the CDC and causes 1 in 3 hospital infections. It's a $10 billion market that's only increasing. So we have screened a diversity of immune beacons, and they're linking to different targeting elements, with that immune beacon sequence being key to enhancing the immune response, recruiting them to our MRSA infections. And so we've then verified this strategy in a mouse pneumonia model and seen that our attractive killers result in a 2-fold decrease in the load of MRSA in the lungs, and also it improves the pathology where our attractive killers leave the alveoli intact compared to the standard of care antibiotic vancomycin. So we're on the road to market where we've developed our hit to lead, and because our attractive killers would also have the extended exclusivity period and would be fast-tracked by the FDA, we have that potential. But to reach that stage, we also have multiple exit strategies along the way. And for us, we have a 3-year plan ahead of us that will require an ask of about $7 million. But at the end point of that, we have 2 potential exit strategies. One being a partnership deal with the accelerators for antibiotic development, either CARB-X or GARD-P, and there's also licensing potential, such as the pre-IND deal between Forge and Roche. So we have this multidisciplinary team with over 25 years experience in chemistry, microbiology, and antibiotics. It's because of this, and that's coupled with the key opinion leader, Anton Pellig, and his knowledge of infectious diseases, that we've been able to develop this as an effective strategy to ensure that both the needs of the patient and the clinician are met. So that leaves me to ask you, are you joining us on our journey to arm our innate immune system with attractive killers to help stop the next potential global health crisis?